This segment of Delmarva Life is brought to you by Community Behavioral Health.
You know, when it comes to other people's kids, sometimes we're guilty of being judgmental when we see them misbehave. You see a child act out in the grocery store and immediately think, well, the parents need to do something to control them.
Oh, yeah. Well, the thing is, we probably don't know what's going on in that child's life or what kind of journey his or her parents are navigating through. Well, that journey could involve a mental health disorder. According to a study in the Archives of General Psychiatry, about 20% of adolescents have a diagnosable mental health disorder. Another study in the Journal of Adolescent Health suggests that among adolescents with mental health needs, 70% do not receive the care they need. Well, joining us today to talk more about common mental health disorders in children is Dr. Sushma Jani, Medical Director at Community Behavioral Health. Thank you for joining us this afternoon.
Thank you.
Those numbers are, looking at those numbers, it's amazing. So what kind of mental health disorders are we talking about?
Most of the time, children, whether they have mental health disorder, the way we figure out or we think, is child developing normally? Or is there a deviation from the normal development? But typically ones where they have learning problems, they have deficit of attention, they have anxiety problems, they have depression, they have thinking disorder, or they can have autism, or some severe reaction, as we heard earlier, to a child abuse or neglect. Yeah. So these are the symptoms they present in terms of mental health issues.
How early on can you diagnose something like this in a child?
Children are born with certain temperament, and now there is a new evolving field of infant psychiatry. Yes, actually at Hopkins they've had a fellowship for over 20 years, and there are signs and symptoms, and early on one could detect and understand.
My goodness.
Wow, that's amazing. Are there signs and symptoms that a parent can look for in a child?
Yes. If your child is excessively energetic or excessively grumpy or sad, not mixing with other people, refusing to go to school, or overly aggressive, more than a little fights, but we're talking about overly aggressive, right, or overly obsessing with something, and that interferes with your relationship or their relationship with their friends or their ability to do schoolwork or play with other people. If it's outside the norm, then it is time to pay attention. If they're excessively oppositional or defiant and have a lot of meltdowns, what I call meltdown is when a child is screaming or kicking or throwing themselves on the floor, and you cannot really comfort them.
Right.
What child is screaming of is the pain, the emotional pain that he or she is experiencing. We have this strange thing about physical etiquette versus what I call emotional etiquette. Let me tell you a small story. If I were to stomp on your toe, you might feel like wanting to stomp back at my toe.
Yeah.
But if I say, sorry, I really didn't mean it, you would accept my apology and not do that to retaliate.
Right.
However, if you're experiencing emotional pain, let's say you didn't show up till midnight and your wife is waiting, and she's pacing around and she's walking around, and then she tells you, where were you? And then you say, well, honey, my phone was off and I couldn't be there. She'll try to not accept that explanation, and start yelling at you. And if you still are calm, then she can bring up something that happened 10 years ago and throw in your face until the point you get mad, so you know exactly how she's feeling. So we have no etiquette when it comes to emotional pain. We throw it on to others easily. So that's the best way for a parent to pick up. If you find yourself getting excessively angry or hurt or in pain when you look at your child, maybe this is the time to do something, because we can perceive that. And a lot of us as therapists use that to diagnose, in addition to the standardized symptoms or checklists or the tools that we have that are given to us by American Psychiatric Association, and that's what we use.
Yeah, and that leads to the next question about the screenings and testings that you do use.
Yes. So on our website at communitybehavioralhealth.net, we have availability for self-screening for children and adolescents, or if parents want to answer certain questionnaires which are devised by American Psychiatric Association, and they are free. One could take those self-screening tests and also understand if they need that additional help or not. We also use computerized tests to measure attention, impulsivity, distractibility, or disengagement. Sometimes children come to us and say, oh, I wasn't paying attention, or I couldn't do the work. And we are treating them for ADHD. Come to find out, they were able to pay attention, but they were just not turning in homework. So we should be increasing medicine for that.
Right.
So those are the tools we use to actually assess and make sure we're not accidentally over-medicating them just based on the information we received from parents and children. So we measure them using a 20 minutes or 15 minutes computerized test.
Okay, so could this simply be something my child is going to grow out of?
A lot of cases that is true. If they get early intervention, most of these children learn to adapt and do really well. And we have some stars like Michael Phelps, who has attention deficit disorder, and he has, as we know, has put it to his best of his talent. And he's sort of grown out of it. Sort of grown out, because he still has energy in the water, and we want that.
So it's possible.
It is possible to grow out of it. Yes.
Very interesting, and I think it's important to note that if your child does have one of these conditions, it's just like any other physical condition, isn't it?
Yes.
You want to treat it.
Yes. Just like asthma or diabetes, we want child to live a normal life. So any mental health illness should not be a centerpiece of their life. They should be on the side, and we should continue to achieve one's fullest potential. And it's our job as parents and teachers and guide to
Don't be judgmental, be your mom and dad and help.
There you go.
Yeah, thank you so much, Dr. Johnny. Very, very interesting. And if you would like to read more about community behavioral health and the services they offer, or to look at those screenings that are online, just go to our website, delmarvalife.com.